All right. Good morning, everyone. My name is Martha Matocha, and I'm a program director in the Office of Extramural Programs at the National Institute of Nursing Research. And I'm here at the conference with my colleague, Dr. David Banks, and we'd like to thank the SNRS for inviting us to present updates about NINR funding and other aspects at their 28th annual conference. So the National Institute of Nursing Research, I'm sure you're familiar with, we celebrated our 25th year anniversary in 2011, and at the concluding symposium at that celebration, we released our strategic plan, Bringing Science to Life. And in that strategic plan, you can read about our research focus, which includes symptom science, wellness, end-of-life and palliative care, self-management, technology, and of course nurse scientist training. And we're actively planning events around our 30th anniversary. NINR's mission is to promote and improve the health of individuals, families, and communities, and to do so we support and conduct clinical and basic research and research training on health and illness across the lifespan. Again, looking at our strategic plan, you can read more about the particular science that we support. We focus on the promotion of health and quality of life. We believe that we have the premise that engaging individuals as active participants in their own health is a very beneficial way to approach research. We support interdisciplinary approaches, multiple health determinants, including psychological, physiological, environmental, cultural factors. We support basic research to understand the underlying biological mechanisms, for example, about symptoms related to fatigue and pain, and on health conditions such as obesity. We seek innovative methods to optimize patient outcomes, and we promote health equity and eliminating health disparities in our research. Now, one of our most interactive and innovative initiatives has been the Innovative Questions Initiative. This has just recently been started. It's allowing you, the scientific community, as well as the public, to help shape the future of nursing science. We want you to help us develop questions to point the way forward over the next 5 to 10 years to enhance our thinking and creativity in nursing science. The Innovative Questions Initiative consists of 2 components: the IQ process, in which workshops are held gathering scientists in a particular area to help us develop questions that have not yet been asked or answered. And also, the other component is our IQ website, which you can link to from our NINR.nih.gov website. On the website, you, the scientific community, the public, can submit your own questions as well as comment on these questions. And again, it's a way for you to help us point the way forward over the next 5 to 10 years. We're seeking very results-oriented, innovative questions, and we ask that you promote this website to your community so that we can make the most progress in nursing science and accelerate nursing science's contribution to the health of the nation. Now, NINR has always had a major emphasis on investing in nurse scientists, and in this slide it shows a career pipeline for nurses through our training, education, and career development support, which years and continue through the pre-doc, post-doc, and new investigator and career researcher stage. And I'd like to highlight on the left-hand side the Graduate Partnerships Program, which is a program in which pre-doctoral students carry out their academic work at their home institution, and they can come to the NINR intramural program to carry out their research. We also offer the Summer Genetics Institute program. Every summer, it's an intensive hands-on training for nurse scientists to gain hands-on experience in molecular genetics that can be applied to clinical and basic research, clinical practice and basic research. We recently selected the head of the Office of End-of-Life and Palliative Care, Dr. Jerry Miller, and you'll be hearing more about this office in the future. Another new initiative is our Palliative Care Conversations Matter campaign, launched by NINR to raise awareness of pediatric palliative care. You can get more information about this campaign through our Office of Communications and Public Liaison. We also have a flyer at our exhibit booth. Now, NINR's intramural research program has some opportunities coming up in 2014, the Summer Genetics Institute. The deadline for the application is coming up very quickly, March 1st. NIH itself has a summer internship program that NINR participates in. That application deadline is coming up March 1st. And also we have our methodologies boot camp. The application process will open April 1st. And this year the boot camp focuses on big data. For more information on our extramural programs, please go to our website where you can link to, for both the extramural and intramural research program. Now, on these last two slides, I want to announce two employment opportunities that are upcoming. One for the NINR, an NINR extramural program director, and my understanding is the usajobs.gov announcement was just released today or maybe even last night. We're looking for a program director committed to excellence in science, serving as the first point of contact with the extramural community. We have more information on a flyer at our exhibit booth. And finally, we also have an opportunity for a nurse scientist to lead the division of extramural programs. Key functions include participating with the director of NINR and the NINR deputy director in program planning and policy development. To request an alert when the announcement is posted, you can contact Dr. Carolyn Samsel, or it might be easiest to provide your business card at our exhibit booth, and we'll provide you an alert when the announcement is posted. And I just want to tell everyone that at 1:30 we start up our roundtable sessions again. If you have other questions, please come and see Dr. Banks and I at these roundtable sessions. We'll be there at 1:30. We'll be happy to answer all your questions, even if you didn't sign up. Thank you.
All right.